currently trends in facial rejuvenation are people today want to be able to, they want little downtime. They want to be able to go back to work, resume any other activities, and they want to look natural. So more recent trends, of course, are going to be so when a patient comes to talk to me about facial rejuvenation, I now will divide that into surgical and non-surgical so that I can give patients options. And once again, a consultation is important because someone may not have the option of having non-surgical rejuvenation if they clearly need surgical facelift or mini facelift. But the non-surgical options, of course, are going to be your dermal fillers and your Botox and, generally speaking, skincare regimens, whether those are some sort of micro laser peel or the BBL treatments, which are your photo light therapy treatments. So that is your non-surgical. And I will be able to direct them if that is the area that they're going, because some people clearly come in and say, I do not want surgery, or I'm not ready for surgery. I want an introduction into plastic surgery before I ever think about having anything surgical. And so we do have a fair amount of non-surgical options that are very nice and certainly give some facial rejuvenation. And then I'll lead a patient kind of up the line to, okay, now I can give you the gold standard, which is your facelift. And then I'll tell them, okay, this is what a facelift can do. You know, it helps with jowls, it helps with the nasolabial folds. It is very extensively helping in the neck as far as any kind of banding or turkey gobbler type look of the neck, any loose skin. And that's going to be your gold standard as your facelift. However, I have found that many of my patients are not ready for the facelift yet. And so what I do a fair amount of, and which everybody appears to be happy, I've really not had any complaints so far, is what goes by various different names. Will be like the mini facelift, the max lift, the lifestyle lift, the quick lift, and they're all kind of variations on the same theme. But basically what a mini facelift is, first of all, in my practice, and it may be different in other practices, but in my practice I do offer it under local anesthetic, where the patient actually has takes a little Valium or a little narcotic by mouth, and then we'll have basically I'll inject them with the numbing medicine, which is similar to like when you go to have your teeth filled. And what that entails is making a small incision in front of the ear and following the natural creases of the ear, and doing a more minor procedure in lifting up the skin off of the fat. And then you have what's called fascia underneath, which is also a tissue that can lose its strength and its elasticity. And so we tighten that fascia with suture and then redrape the skin and cut off the excess to help with rejuvenation. A lot of times I'll add a little liposuction just underneath the chin or in the jowl area. But it does again help the nasolabial folds, the marionette lines, again, the jowls, the jawline, and it does give a little of neck contouring. So it's not to the extent of a facelift in the neck, but it does help with some neck contouring. And that procedure, again, most people, because it's a more limited procedure than the facelift, the downtime, the less surgery, the less downtime. Also, recovery time is quicker. People can go back to work sooner. They can go out in public sooner than with the full facelift. And that's a very popular procedure, and a lot of people like it because a lot of people are afraid of the big procedure, the facelift. They're afraid of, oh, that's too much for me. I'm not ready for that right now. And so this is a really good procedure for them, and it has more longevity to it than the facial fillers or, you know, some other minor procedures.